Atrial fibrillation is the most common heart rhythm disorder in adults. It's affecting millions of Americans and it's growing every year. In atrial fibrillation, the electrical signals in the upper chambers, the atria, become chaotic and disorganized. And when that happens, the atria quiver instead of pumping the blood through cleanly. That allows bloods to clot and blood can pool and blood clots can flip off and cause stroke. Additionally, all those electrical impulses making their way down to the bottom chamber can make the heart beat too fast or slow or irregular, and it makes the heart a less efficient pump. That causes lots of symptoms and causes lots of problems for patients. The most common symptoms of atrial fibrillation are palpitations, or the sense of your heart is fluttering or skipping beats. Some patients will also feel minor chest discomfort, or they'll feel shorter breath. Frequently, people feel more fatigued, they've got less energy, and some patients feel lightheaded. Atrial fibrillation can affect anyone at any time, but it's primarily a disorder of older adults. It's rare in patients less than 55 years of age, but after that, it starts becoming increasingly common. And by the age 80, about 10% of us will have atrial fibrillation. The other most common causes or risk factors for atrial fibrillation are other heart disease, like valvular heart disease, high blood pressure, coronary artery disease, or diseases of the lungs like COPD. Additionally, there are some metabolic disorders like thyroid problems that can cause atrial fibrillation. To find out if you have atrial fibrillation, there are some things that you can do on your own. For example, just getting familiar with checking your pulse or using a blood pressure cuff that checks heart rate and gives alarms for irregular beats is one simple thing that many people can do on their home alone. Additionally, in the digital age now, there are all these smart mobile technologies that have some capability of screening for atrial fibrillation. For example, some of the newer Apple Watches, I believe the newer Fitbits are going to have this available, and there's a product by AliveCor called the Cardioband. All of those things allow you to take simple ECGs on your own or electrocardiograms on your own that can help catch atrial fibrillation. Now, of course, the gold standard is to see your doctor and actually have an EKG when you're having symptoms to see if you're in atrial fibrillation at that time. Or if you have intermittent symptoms, sometimes we have people wear a monitor for a week or a month to see if we can catch it intermittently. Treatment for atrial fibrillation has made enormous leaps and bounds in the last few years. Most patients with atrial fibrillation have a high enough risk of stroke that they should be on blood thinners to keep the risk of stroke as low as possible. However, for people that can't tolerate their blood thinners, we have a new technology called a Watchman. This Watchman device is implanted in the heart and it seals off the area which is most responsible and most likely to cause blood clots and stroke. And it's a great way of getting patients off blood thinners while keeping their risk of stroke as low as possible. Additionally, many patients will need medications to slow their heart rate down, and some patients, if their atrial fibrillation is bothersome to them, may use antiarrhythmic drugs to help keep them in normal rhythm. Finally, for patients that are particularly symptomatic with their atrial fibrillation or have complications because of their atrial fibrillation, a technique called atrial fibrillation ablation, where an electrophysiologist goes with catheters through the veins in the legs up to the heart and finds the areas in the heart that are responsible for the atrial fibrillation and can burn or destroy and ablate those areas, which helps keep patients in normal rhythm far better than any of the medications we have. It's important to know if you have atrial fibrillation and take it seriously, because atrial fibrillation increases your risk of stroke by about 5-fold. Additionally, atrial fibrillation can predispose you to heart failure, and if left untreated, atrial fibrillation may increase your risk of dying early. Heart disorders such as atrial fibrillation, heart failure, and stroke don't stop just because we're in the middle of a pandemic. And for many people, the risks of those disorders far outweigh their risks of COVID-19. Additionally, doctors and hospitals have really learned a lot about COVID-19, about how the disease is transmitted and how to keep patients and themselves safe when having ongoing healthcare encounters. The personal protective equipment, the temperature checks, the strict enforcement of face masks all make visits with your doctors and other healthcare providers much safer than it was at the beginning of this. And I think for most people, the risk of delaying diagnosis and delaying therapy far outweighs their risk of contracting COVID-19 with a healthcare encounter. I really encourage anyone who's concerned that they may have atrial fibrillation to talk to their primary care doctor or cardiologist and get screened. For patients that are confirmed to have atrial fibrillation and are having problems with their atrial fibrillation, I'd recommend considering going an extra step and consulting with a cardiac electrophysiologist. Cardiac electrophysiologists are heart doctors that have special training in heart rhythm disorders, and their focus and passion is taking care of patients with these heart rhythm disorders such as atrial fibrillation.